Major funding for NJN News is provided by PSE&G, serving customers, strengthening the business community, and investing in New Jersey's future. Wachovia, uncommon wisdom for shared success. Verizon, communication solutions designed for the people and businesses of New Jersey. And by the New Jersey Education Association, working for great public schools for every child.
The state is one step closer to universal health care tonight. Governor Corzine signed a bill today that officials say mandates health insurance for children, although it's a voluntary program. Senior political correspondent Michael Aaron reports.
This is a legacy piece of legislation.
New Jersey has about 250,000 children without health insurance. The bill that became law today would try to enroll as many as possible in the state's family care program, plus about 80,000 of their parents. Chief sponsor Joe Vitale says the mandate is more symbolic than real.
It's a non-punitive mandate. We don't believe that parents should be punished if they forget or they overlook or they're unable to cover their kids. So we say it's a mandate because we want the state particularly and all the provider communities to take this seriously.
Effective September 1st, the program is estimated to cost $8 million the first year, $38 million in year 2, and $64 million in year 3. Its backers say it will more than pay for itself by reducing the amount the state spends when an uninsured person seeks treatment in a hospital emergency room.
We discovered during our debate that it costs $913 less to the state of New Jersey to provide access to family care and help support parents to help them pay for their premium than it does to pay for their charity care.
The state will spend $1 million promoting family care and will automatically enroll an uninsured child who signs up for a free school lunch or visits a doctor's office. Some families will pay, for some it will be free. In addition, parents will be able to enroll children 18 to 30 years old for $2,400 per year, and other market reforms in the bill will try to make health insurance more affordable. While the poor have Medicaid and the elderly have Medicare, New Jersey still has more than 1 million uninsured, or about 1 of every 9 residents.
We're talking for the most part about the working poor. People who have a spouse, a parent, who go to work every day, but who are not provided health insurance at their place of business.
The bill was signed at Raritan Bay Medical Center in Perth Amboy, a hospital in Vitale's district with a high charity care caseload.
We have a law, folks.
The governor said he hopes Washington wakes up and joins New Jersey in this effort. This is phase 1 of the state's plan to achieve universal coverage. Phase 2, designed to reach 700,000 adults, could be rolled out as early as this fall. Michael Aaron, NJN News, Perth Amboy.
This is Eyewitness News, the news leader, with Diana Williams, Shade Berenois, and Lee Goldberg with the exclusive AccuWeather forecast. Now, Eyewitness News at 5.
An historic and bold move in New Jersey tonight, health care coverage for every child in the state. Governor Corzine signing the bill today. It requires that the state's family care program provide health care coverage for all New Jersey children. Now, in this first phase, 250,000 children and low-income families will be covered. The bill aims to provide all residents of New Jersey with health care insurance by the year 2011.
You're watching WMBC TV, Newton, New Jersey.
Plan to fund transportation improvements in the Garden State. Good evening, everyone, and welcome to WMBC News Tonight. I'm Matt Fitzpatrick. Thanks for joining us. We'll have those stories and much more news tonight, but first up, New Jersey lawmakers took a dramatic step today towards providing health coverage for nearly all of the state's 9 million residents. As Howard Monroe Gray reports, New Jersey is now on the vanguard nationally when it comes to providing coverage for all its children.
This is a legacy piece of legislation.
Governor Gov Corzine speaking just minutes before signing into law a bill expanding the state's family care program to include parents who are up to 200% above the poverty level, increasing affordability for individuals and small businesses, allowing dependents up to the age of 30 to enroll under their parents, and mandating that every child in the state has health coverage.
We're mandating every child in the state of New Jersey to have health insurance. We want to get people off charity care and out of the emergency rooms into preventive care, ongoing care of chronic diseases.
Senate President and former Governor Richard Cody.
The people that we're effectuating something for are not the very poor, because as you know, they're covered by Medicaid. The very elderly, covered by Medicare. We're talking for the most part about the working poor.
Currently, there are over 1.4 million New Jerseyans who don't have health insurance. Assemblyman Louis Greenwald, who co-sponsored the bill, said that's unacceptable.
It is outrageous and beneath us that 1.4 million New Jerseyans get up, go to work every day, just like all of you in this room, but have no health insurance.
The bill, which will cost the state close to $8 million in the first year and about $60 million after 3 years to implement, passed unanimously in the Senate, and the majority of the Assembly approved it. Senator Joseph Vitale sponsored the bill.
For over 1 million New Jerseyans, they wake up every morning scared to death that something will befall them, that an illness to their child, to themselves, will not only cause them physical grief and anguish and pain, but financial loss.
The state's current family care program insures over 20,000 people. The new law anticipates that within the first year, close to 100,000 parents and children will sign up for coverage.
I assure you that when you look back 10 years from today, you will say we've made a great stride forward and we are on a stepping stone to universal insurance for every New Jerseyan.
And starting September 1st, parents will be able to get their children this insurance through their schools, hospitals, and other health care clinics. And the governor hopes that every child within the state of New Jersey will be insured within 1 year. And although the insurance is mandated, there is no penalty should parents choose to decline the insurance. I'm Howard Monroe Gray for WMBC News.